Stigma remains a significant barrier to HIV prevention, testing and treatment. People living with HIV often face discrimination, prejudice, and social isolation. The fear of being judged or rejected can prevent individuals from seeking testing or disclosing their status to loved ones. This silence can have devastating consequences, both for their own health and for the well-being of their partners. Stigma thrives on misinformation and ignorance. It is fueled by myths and misconceptions about how HIV is transmitted. The reality is that HIV is not spread through casual contact such as hugging, sharing food, or using the same toilet. It is primarily transmitted through sexual contact, sharing needles, or from mother to child during pregnancy, childbirth, or breastfeeding. By understanding the facts about HIV transmission, we can challenge stigma and create a more supportive environment for those affected by the virus. HIV transmission occurs when infected bodily fluids, such as blood, semen, vaginal fluids, or breast milk, enter the bloodstream of an uninfected person. This can happen through various means, each carrying its own risks and implications. One of the most common ways is through unprotected sexual contact with an infected person. This includes vaginal, anal, and oral sex, where the virus can be transmitted through the exchange of bodily fluids. Another significant route of transmission is sharing needles or syringes contaminated with HIV-infected blood. This is particularly common among individuals who use intravenous drugs. Additionally, an infected mother can pass the virus to her child during pregnancy, childbirth, or breastfeeding. This vertical transmission can be mitigated with proper medical interventions. Prevention is key in the fight against HIV. By understanding and implementing effective prevention strategies, we can significantly reduce the spread of the virus. Condoms remain one of the most effective methods of preventing sexual transmission of HIV. They act as a barrier that prevents the exchange of bodily fluids, thereby reducing the risk of infection. When used correctly and consistently, condoms provide a reliable means of protection. It's important to ensure that condoms are used during every sexual encounter to maximize their effectiveness. Another important prevention strategy is pre-exposure prophylaxis, or PrEP. This involves taking a daily medication that can significantly reduce the risk of HIV infection. PrEP is highly effective for people who are at high risk of exposure, such as those with partners living with HIV or individuals who engage in condomless sex. It requires a commitment to daily medication and regular medical checkups. By combining these prevention methods with regular testing and education, we can create a comprehensive approach to reducing HIV transmission and protecting public health.